Steve, and I'm here with John Silcox, who is the Communications Director for the Fort Wayne Allen County Health Department. John, can talk a little bit about H1N1 today. What's the current status in Allen County?
Well, we've been happy to report that our flu activity in the community has really waned here in the last few weeks. So we're not seeing the numbers of folks showing up at the hospitals, ERs, and urgent care clinics the way they were in those peak weeks in early and mid-November. Our school absentee rates have gone down, so we're not having as many ill kids in school or not going to school because of flu activity. So that's been good. We continue to offer the H1N1 vaccine at our Carew Medical Park Clinic, and it's also been made available through other providers in the community, doctors' offices, pediatricians. So we've been continuing to do that, and we continue to urge people to take advantage of getting vaccinated. Because of the limited supply of the vaccine in those early weeks, we weren't able to just make it available to everyone. We really had to prioritize who really needs to get this vaccine because who is most at risk for this illness. So that's why we really restricted it initially to those priority groups that were identified by the federal government as the highest risk people. That included pregnant women, children, caregivers, and people that had some chronic health problems. Beginning next week, we'll start offering that to more people, probably all the way up to age 64, no matter what your health condition. So we'll be able to get a lot more people vaccinated who maybe previously hadn't had the opportunity yet or who weren't in one of those priority groups. So that will be occurring over the next couple of weeks, and we expect our traffic at our Carew Medical Park Clinic to go up a little bit as we have more people coming for the vaccine. Now, it's really important that people understand that just because the flu illness and the flu activity has waned in the last few weeks, that doesn't mean that we're over and we escaped unharmed. We will continue to urge people to get vaccinated because, as we've seen in the past, when you have a new type of flu strain go through a community, it can actually make a couple of different pass-throughs. And we could see another wave of this type of illness in January or February when we typically have our flu season. So it is still important to get vaccinated, even if you had some flu symptoms or felt like you were sick at one point this fall. Unless it was really laboratory confirmed as H1N1, it could be any number of viruses. So getting the H1N1 vaccine is still recommended. And again, you can get it free at our clinic, and probably the next couple weeks you're going to start to see that it's available in other places where it hadn't been in the past, such as your neighborhood pharmacies and drugstores. Now, they may be able to charge a small fee to give the vaccine in those businesses, but it's still free vaccine when you get it at the health department clinic. So that's really where we're at right now, and again, we expect that we'll continue to be offering the vaccine at our Carew Medical Park Clinic for foreseeable future.